I'm Norda. I'm one of the senior nurse practitioners from NHS Blood and Transplant. And we do welcome and encourage hemochromatosis donors to come along and join to donate their blood. So I'm just going to go in through today with you just a brief introduction as it relates to NHS Blood and Transplant, why become a blood donor, just to highlight the specific eligibility criteria for genetic hemochromatosis donors, and as it relates to or guidelines as it reflects on the website, how to register, and the process for people with hemochromatosis to donate. We go through in terms of the letters that we tend to send to our donors and the forms to complete, the eligibility criteria, and some recent improvements that we've had to make the process much easier for all our donors. So that's a bit of a history, really. The first, in 1818, we had the first successful human-to-human transfusion. And so the ABO blood group was identified back there in 1901, and 1937, the UK first set up its blood bank. We have the identification of the RH system, that was a blood grouping system back there in 1940. And, a bit of a history there. In 1946, the history of health, the National Blood Service was developed around that time. Yes, and of course, back just skipping over because I'm just conscious of time. There in 2000, we have the establishment of the UK transplant system. And in actually 2005, we actually have the establishment of what is now NHS Blood and Transplant, which was followed the merger of the two national services then. So in essence, really, our role is to supply blood components to England through voluntary donation, and responsibilities to ensure really the safety of donors, recipient, and everyone really in the organization. And we are bound in terms of the work that we do by legislation, and even the guidelines that we develop. These are mandated through these legislation from the blood safety and quality regulations here, which was established in 2005. And approximately 1.7 million of blood donations are collected every year. So we are very much so grateful to our donors, our committed donors who, commit to really maintaining and optimizing our donor panel year on year. So why become a blood donor? So with genetic hemochromatosis, often, as you know, you go to the hospital and the blood gets discarded. But through coming to the blood service, we're able to utilize those bloods for the effective, use for patients in hospital and optimizing their, outcome for their health conditions. So with healthy iron levels, genetic hemochromatosis donors are unlikely to fail the hemoglobin test or become anemic. And we have a procedure code on within NHSBT for every hemochromatosis donor, where once you register, this code, HE code, is applied to your record. So what this does, it accommodate the need for more frequent donation than is typical in our regular donor whole blood panel. And the code allows up to 3 appointments to be booked in advance. So for a normal donor, the frequency of donation we have is every 12 weeks for males and every 16 weeks for female. However, with our hemochromatosis donor, we do accept more frequency donation as frequently as 6 weeks to donate. So this code being applied to your record gives the ability for you to be able to book appointment more frequently. And also too, we've had development in our service where now we do have available a priority number where you can ring that contact number and be able to book an appointment much more easier than it is for other donors. So there's a new priority booking number there. And many people find donating of blood with NHSBT a positive experience than having a venous section in the hospital. And we're all aware of the constraints it is on the hospitals, and oftentimes getting an appointment for venous sections there can be very much more difficult. Yes, and so we have this is just a testimony of one of our donors, hemochromatosis donor, who's sharing how easy they have found donating with us opposed to donating in the hospital. So as it relates to donating blood with us here in NHSBT, we have set criteria that all our hemochromatosis donor, we advise, it's important that that is fulfilled before we are able to accept a donation from yourselves. And basically, as I had highlighted before, we are bound by legislation, so that is the law. And so we have set guidelines that, we must apply to ensure that we are optimizing safety for all donors and not putting anyone at any risk. So there are set guidelines in place. And these are based upon the UK JPAC guideline and the BSQR guidelines. And so for each and every hemochromatosis donor, once you have confirmed the diagnosis of genetic hemochromatosis, and have been having alternative arrangement for venous sections. So the first one, going to be having a confirmed diagnosis of genetic hemochromatosis and have started your venous sections, and you have no significant complications of iron overload in any organ, including heart or liver. So you would all be aware that you'd have been seen by your specialist, you'd have had scans done just to rule out that there's no heart or liver involvement. So these are questions that when you come to us, we'll ask to get that assurance that there's no iron overload affecting any other organs. Also, it is important that you meet the requirements for blood donation. So like for all our blood donors, we go through a series of questions. So we collate any significant medical history, any medication history, any travel history. There's a hemoglobin screen that is done. And once you fulfill all those and there's no underlying medical condition that would preclude you from donation and there's no medication, will you be able to sign up, register, and donate. So we welcome donation from our hemochromatosis donor once they're nearing completion of the intensive venous section stage. So ideally, we would like for you to be in the maintenance phase of your donation and and your ferritin levels is deemed to be within the normal range of ferritin. Okay, so and once you're not requiring any other treatment like iron chelation treatment, once it's just you're in the maintenance phase of venous sections, that is a criteria that you'll be fulfilling, or we'll be able to accept you. So we also established that you have no adverse reaction through donation. I know through venous section. Sometimes individuals may need to have some IV fluids whilst you're being venesected. They may have adverse reactions like fainting. So once we've established that you've pretty much been okay with venesections, you've not had any adverse reactions, and you have been absolutely fine, then, that'll be fine. We'll be able to accept. And so we require donations or venesections no more than every 6 weeks. So that's the frequency. So you can donate from as frequent as 6 weeks up to above as your specialists have indicated. So the interval from last venous section must be at least 6 weeks. So once you have had a venous section in the hospital, and once it's over 6 weeks, we can, get you reinstated and start donating. And also, too, we expect as well that your hemochromatosis will continue to be monitored by your specialists. So we'd expect that your senior specialist to have your ferritin levels checked, and that is being continually monitored, because ferritin is not one marker that we do review at NHSBT. So we have information online that you can log on to if you'd like to find out more details with regards to how often you can donate, or if you may have an additional another diagnosis and you're not quite sure whether that would preclude you from donating. You can accept our website on NHS blood donation, and then you can actually get further details as it relates to donation. You can also log on online to book an appointment. However, we are aware that there are times when that may be a bit difficult, and so we encourage that you call and have your appointment booked, and you're at the liberty to book much more in advance. And there's also a specific dedicated number that our hemochromatosis donors are able to ring and get an appointment book. And so when you log on to the our website, you'll see a page looking like this. So for example, you've had a recent travel to, say, somewhere in India where there has a risk of malaria. So for anyone who's had a recent malarial risk, we would advise to wait for at least 4 months prior to donating. And if this is the case with yourself, then on this occasion, unfortunately, we will not be able to take a donation from yourself. However, we'd advise, if you're really needing venesection, to arrange with your specialist or with the hospital to get it done. So the website is you're able to access that you can get these details, just to have that assurance that you're not going to be turned away from session. Likewise, as well, you're able to contact us and through our helpline, where we can give you further details as it relates to hemochromatosis and your eligibility to donate. And so we have more information as well as it relates to hemochromatosis. There is a leaflet that is available that gives you the details as it relates to hemochromatosis and or acceptance criteria as well. And there's a number there that you can call through. So this is just questions that are often asked. We says, yes, we do accept donors with hemochromatosis. We advise, though, for the processes, once you have been told or encouraged by your specialist to come along and donate, we ask that you contact the helpline at first hand. Contact the helpline. And what will happen then is that you'll be put through to, so there's a number. So you'll be, if you contact the helpline, and you will initially be asked a few questions by the call handlers there, you'll be put through to us in the clinical support team. So the clinical support team or colleagues like myself, who will then be in contact with you just to find out, have you completed the initial bit of your intensive treatment of your hemochromatosis? What's your recent ferritin levels? We will be establishing that you're not on any other treatment, like any iron chelation treatment. We'll be establishing that you've been fitting well throughout those venous sections. We'll be establishing that there's no underlying conditions. For example, we just wanted to know, have you had any heart problem, for example? there are certain conditions that we're not able to accept because of the potential risk to the donor. And so once you have no underlying condition that would actually preclude you from donating, then we can accept you. We want to make sure that there's no significant medical history that would either put yourself at risk or put any other or a recipient at risk. So once that is confirmed, we then will ask to send you, we get your details, and we'll send you an agreement form that we ask for yourself to complete. So we've improved the system because beforehand we send it to you, take it to your specialist to sign. Now we're not requiring you to get a specialist signature. But what we just want in that agreement is that you're agreeing to the criteria and you have a full understanding as it relates to the remits where we are able to accept. Because if there's a case whereby we're unable to accept you, for example, a recent travel, then you need to see your specialist for if you're needing urgent venesection, or if it's in the case whereby we have if there's any other underlying condition, or your ferritin levels are above in terms of the remit we can accept, then again we would not be able to accept. So we ask that you would sign this agreement form that we send out to you, just to make sure that there's a clear understanding of the criteria and that you still remain under your specialist, because the specialist does need to be able to do your follow-up and to continue to monitor your ferritin levels. Okay, so once you return to us, then we will apply that specific code on your record, whereby you'll be able to come along, book an appointment, and donate with us. Yes, so you have the liberty of booking over the phone, bringing our calls, our helpline to book, and of course, there's the priority booking line that I told you about. So people with hemochromatosis over 70 may be able to register, because at the moment there is a cutoff period. So if you have not donated up to 66 years old and have not donated within the last 2 years, then for normal donors, we'd advise against donation. However, with hemochromatosis donor, the venous sections that you have done within the hospital would be considered as a blood donation once it was done over 6 weeks ago. So people with genetic hemochromatosis over 70 may be able to register as a new donor, provided they have had a successful venous section in the previous 2 years and had no reaction to the venous section in the past. All right. So once you've highlighted and we know that you've been having a frequent venous section, you've been fitting well, there's been no adverse reactions, we can consider getting you registered to donate. Okay, so before you donate for the first time, as I was saying, one of myself, I'll contact you, and we'll go through all the ramifications as it relates to blood donation, and just to make sure that you're fitting well and you're you're okay to donate. And once you've returned to us the form, we get you up and going. So just to give you an idea, this is what the form looks like that we send to yourself. We include a prepaid envelope which you return to us, and once we're in receipt of that, we are up and ready to go and donate as at a convenient time for yourself. So when you do attend session, for those of you who have never donated before, there's a donor safety record that is actually once you have an appointment book, it will send to you in the post. You take it along to the session, and those questions are asked and go through with you, just to make sure that you're fulfilling all the criteria as it relates to blood donation, and that there is no possible risk there. So you'll be asking questions about medication, any recent investigations that you might have had. They do ask some lifestyle questions as well, and also travel questions that will be asked. So really, our aim is to make this process as really easy, streamlined, and hassle-free for all of our donors, and more so for our hemochromatosis donor. We have been in dialogue with Hemochromatosis UK, and we have listened, and we have tried our best to improve and our process in getting hemochromatosis donor, and to make also our guidelines clear as it relates to hemochromatosis. So we have been improving the services, and we have made a few changes. So now we have a specialist signature. It's not you where you before we would ask for you to go to your specialist. That is now not required. Now you're able to book several donations in advance, the ability to book appointments online without calling back. So you have ability to access your record, access online, and book your appointment. There's a priority number that you can ring to access appointments, and greater awareness within the secondary care of blood donation, and with the option of giving leaflets as well. So we have leaflets available. There's one on our website, and I believe there's our leaflet there is on the hemochromatosis website as well. And so once you're within that phase where you don't need an intensive treatment at all, then you can come along and give a donation. Yes. So we have 25 main donation centers in England and thousands of community venues supported by the mobile team. And we complete the health screening through the health check questionnaire. So interview does happen at the session. There is the hemoglobin screening. And once you have, fulfill all these, then it's okay. And of course, we try to limit in terms of any adverse outcome as much as possible. So as you may be aware, with blood donation, there's always sometimes an increased risk of fainting. So you'll be getting supplementary fluids at the session. You'll be encouraged to do set exercises just to, limit any adverse reaction of fainting. And as well, with our hemochromatosis donor, you can actually attend every 6 weeks, opposed to other donors that we advise to have a frequency of 12 to 16 weeks of donation. And I've come to the end of my presentation, and thank you for listening. And I'm here for any questions that you may have. Hope that was clear and I didn't whistle through too quickly. I know it was just a bit delayed with coming online. So I'll stop sharing, and I have any questions that you may have to ask.
Actually, thank you, Norda. I appreciate that. And I'm sure we've all come away feeling like we've learned something, or a thing or two at least.
Okay.
I will.
Am I stop sharing, or can you see me?
I can still see you. Yeah, you've stopped sharing.
Oh, there you are.
What I will do, we've had a few questions that have come in via email. So I'll go through those first, and then it will give time for, if anyone else wants to ask any further questions, use the Q&A box, and we'll come back to those after the email questions.
Sure.
Is that okay?
Yeah, that's fine. Yes.
Brilliant. I'll start with the email questions. You'll have to forgive me because there's a condition in here. I believe it's PCT, but I can't pronounce the full name properly, but I'll do it as best as I can.
Okay.
I've got hemochromatosis, and I think it's porphyria cutanea-tarda, so it's PCT. I'm sorry if that's not how you pronounce it. I don't have a medical background, unfortunately. As you know, you can have both, and treatment is the same. So venesection if ferritin is over 50. Years ago, when I spoke to the blood donation service, they said I couldn't donate due to PCT, even though the treatment for both conditions, hemochromatosis and PCT, is the same. I've been in maintenance for decades. Would I be able to donate now?
Okay. I'm just quickly checking our guidelines as it relates to PCT. So as this is a metabolic condition. Okay, let me see. I don't think there's anything specific on our guidelines with regards to that. Was that in an email? Do we have the email address of the individual that has asked that? Okay, we have it here
I
actually.
do, yes, I do have the email
Yeah.
address. I can.
So I was just looking here, and on our website it has porphyria, which this is PCT is, and it says must not donate if suffers from porphyria, and it says if the potential donor suffers from acute porphyria or acute intermittent porphyria or hereditary, this is another type, coproporphyria, and it is 12 months or more since their last acute attack, and they have no current skin lesions, we can accept. So with this, it's going to be a bit more for conversation with the individual. And I think also too is just to see in terms of where they're at with their treatment, because it says it's almost always an acquired condition associated with the underlying liver disease because of the potential, with liver disease and all, that we would tend to advise against donation. But I think for this individual, it would be a bit more of a conversation and a bit more of an assessment as to where they're at. And potentially there'll be something that we be able to consider, because there are certain types of this that we may be able to accept, if that makes sense.
No, that's great. Thank you. This is being recorded, so what I'll do is
Yeah.
I will send that particular person a link to the recording so they're able to see and
Yes.
yeah.
So really what I would advise is for them to contact our helpline, and they'll be put through to one of like myself or colleague of myself, and we can explore more in terms of where they're at in terms of with this diagnosis and the specifics of it. So it may be that they're able to donate. Yeah.
Thank you for checking that as well.
Okay.
Let's get the next question. So there's a few questions in one. In the past, I've tried to donate by my consultant. They said it would keep me in maintenance. So they went through all the checks and were sat on the bed ready, and then suddenly told that they weren't able to donate because they're on aspirin. So obviously she now gets venesections, and obviously as a consequence, the blood just gets thinned essentially. Apparently her consultant doesn't understand why this is the case. And she just thinks it would be better all round if she were able to donate. So is there a reason she's not able to donate blood because she's on aspirin?
We do accept individuals on aspirin to donate, but we want to know why. Yes. So it is the underlying condition that is meriting aspirin being prescribed and the dosage of aspirin. So it's not a whole blanket no. We are aware oftentimes donors are just placed on aspirin for a prophylactic measure, that's a preventative measure, rather than a treatment measure. So we'll need to establish with the donor as to why they're on aspirin. So again, it'll be more a discussion and more of an assessment to understand the underlying reason for being prescribed. So it's not a whole blanket no. We do accept donors on aspirin to donate, but it's why they're on it and the dosage of aspirin that will enable assessment of their eligibility to donate.
Thank you. And likewise, I'll get back to that person as well
Yeah.
about that. Thank you for
Yes.
explaining that.
Yeah.
Next question. What would be the best course of action to take when you are ineligible to donate? For example, last week I had a donation appointment and they were unable to take a donation from me because I had a future orthopedic appointment regarding a separate issue. And now my account has been frozen. There's a possibility that this could be ongoing for a while. Is there anything to do to change this?
Yeah, so we have one of our criteria. If there's any donor that is undergoing investigation with a specialist, that we say to wait until that investigation is completed before coming along to donate. However, again, is understanding the type of investigation. So, for example, if it's someone who has a slip disc, for example, they may have a slip disc, they may be having pain, they're on pain relief, and the symptoms of the slip disc is being managed. However, they're just following up with the specialist. That would not preclude them to donate. So it's again getting more details about what is ongoing. If it's something that is you're being followed up and there is potential for imminent surgery, we would advise against donation because we do not want to jeopardize at all the outcome of your surgery by taking blood from that individual. So it all depends on what is the condition. Is it just a routine for something like a slip disc or so? We know we'll be able to assess and potentially accept that individual. So it's getting a bit more details really as to what is that condition, what is being assessed, and what is possibly the plan. Is it for surgery? Is it just a routine just to see how you're managing, for example, in the case of a syphilis? Yeah.
Thank you. And what would you suggest the best course of action would be? Would you suggest they ring the helpline as well?
Absolutely, yes. Ring up the helpline, and someone from clinical support will be able to speak with them and, potentially get them up and going to donate. Yeah.
Brilliant. Thank you. I'll get back to that person as well, and
Yes, sure.
hopefully that'll help them on their journey a bit more. Bless
Yes.
them. I'll go on to the Q&A questions now. We've got quite a few coming in.
Okay.
Our very first question. Why is there no communication flow when I have a blood donation back to my NHS record and also to my haematology unit, so my records are updated with the blood donation information? I have to annually get a ferritin blood check. Can't this be done at the donation stage and then my records are automatically updated?
That would be the ideal, but unfortunately, the recording system within the NHS is not centralized at all. So neither are we able to access, records from in the hospital or from the specialists. So unfortunately the system just doesn't allow us to do that because there's not a centralized recording system as it relates to a medical record. So any details that we need, we are dependent upon the donor themselves, or in cases whereby there is still a bit for clarity, we may write to the specialist specifically, but unfortunately there's no way of us accessing that information. Hopefully we have for the future that will be something that will be benefit for everyone where there's a centralized medical recording system. But until we get there, then I'm really sorry, there's no way around that, I'm afraid.
Thank you for going into detail about that. Thank you. I'll go for the next question. I understood that you don't need to be in maintenance to donate. What level of ferritin do you consider to be maintenance?
Now, this is just because there is a wide range. So anything from 25 to up to 450 within that remit. It's a wide range, is considered to be within that remit that we can accept. We do have I would say 10% above, 10 minus 10 or plus 10% above that range. So once you're told by your specialist that you're in this phase, you're not requiring intensive venesection. So anything less than 6 weeks will be deemed intensive. Once you're not in that phase of intensive venesection and your specialist is happy for you to have 6 weekly venesection, then that will be considered in maintenance phase. And once you're fitting well and there's no underlying conditions, then that's okay.
Thank you. This next one's a shorter one. I think you mentioned earlier about like a priority line. So it says, what is the priority number, please?
Yes, I know you're going to ask. I can't remember right off the top of my head. But what I will do, I will send you an email after this, and I'll email you the top there. It's an 0300 number, but I don't want to give the wrong number. And yes, that's part. I'll send it to you after I'll send you an email so you can share to the group.
Fantastic. Thank you. Thank you. Is it possible through NHSBT to have a collection by a narrower cannula, sorry, 20G, not 16G. My veins are narrow and I have to use a thinner needle. Works well though.
I know, unfortunately, no, that's the only needles that we use. And I mean, like in the hospital, they can use various different other veins. You know, we're quite specific because we're aware of, you know, we need a large enough vein and the needle size so that can really optimize the flow of the blood. So I'm ever so sorry. No, there's not a Nora needle that we can use.
Thank you for clarifying that. Thank you. Next question. My GP told me upon diagnosis that I could donate blood without disclosing I've got hemochromatosis while waiting for a liver scan and specialist appointment. I've done that twice since. Will I be told off for now disclosing I've got hemochromatosis? I know my blood went off to do good things, so I hope not, but I appreciate it wasn't playing by the book.
I know. And we're aware that some people do that, but we do encourage, you know, because we depend on the total honesty of all our donor for assessment. It is just making sure as well that we're not putting our donors at any risk. But we do encourage to let us know that you're hemochromatosis, and it's important that you're on the system as such, because if ever they're needing, because this person, their only frequency of donation as a normal donor would be 12 months to 16 weeks rather, 12 to 16 weeks. So the advantage of having that on your record, we're assuring that yes, you fulfill all the criteria, as well as you have the ability to donate more frequently if you do need. So please come and tell us. We will not ban you from donation. We just need to make sure that the right information is on your record.
Thank you. I think it was quite brave of that person to admit that as well, bless them. So
Absolutely,
thank you for going through that.
yes, yes.
If someone returning from living overseas and not donated in the UK before, can they begin donations via the normal donation service, or do they need to register with a specialist first? Or will the referral from the overseas consultant and hospital suffice?
They can come along and donate. However, it is important that they're being monitored. So we'd expect that they'll have either the GP is going to be happy to monitor their ferritin levels. So then they need to be under a medical practitioner. Yeah, so it's important that they get registered to the GP, and I would encourage that they will come with some information, a summary of, you know, their diagnosis and what treatment they've had, and, you know, results from their scans that they have done. So at least that will be on the GP record. So then they'll be able to fulfill our criteria and up and donating. But we do emphasize the importance that they need to be under medical practitioner, so their ferritin level are routinely checked. It's been routinely checked. Yeah.
Brilliant. Thank you. I just want to say a quick thank you as well to everyone who's taken the time to write in a question. We've had quite a few, and it's really nice to see that curiosity in people.
Yeah.
Someone said that they stammer, so the thought of ringing a phone line to go through everything fills them with dread. Is there an email address that they could use instead?
So email address, they can email, but you know, we are professionals. You know, we will give the time it needs to make sure that individual is safe to donate, because we'll need to ask them directly questions and all, you know. So, you know, we will make room and make sure we have the time available to, you know, relieve their anxiety. You know, it's not at all an issue, just to ensure that we are not putting them at any risk for donating. So that's absolutely fine.
Thank you. This next one says, my son has also been diagnosed with GH. He hasn't started any venesections and is just being monitored at the moment. How would he go about being accepted to donate blood, through the normal route or via the GH route?
I'm so sorry. My thing just came up, battery is low, and I had it plugged in, but it wasn't switched on. Sorry. Do you mind repeating that question, please? My apologies.
No, it's okay. My son has been diagnosed with GH. He hasn't started any venisections and is just being monitored at the moment. How would he go about being accepted to donate blood through the normal route or via the GH route?
Okay, so with GH, I would expect that the GP will be doing the referral for him to get checked out. I'm not quite sure in terms of what his level is at the moment. So, as the processor, as I know it, the GP would normally do the checks just to make sure that there's no other end organ damage or any other underlying issue. And once that is clear, they can come along and donate. Yeah. I don't know if that answered the question.
No, I think it did. I think it did.
Yeah.
Would you now they've got it's been confirmed that they have hemochromatosis, would you suggest that they go down the GH route as well as
Yes,
yeah.
absolutely. So it's best. We've had historically donors who just remain as normal donors on our record, and there are still a few that are. However, they're not at the privilege of booking frequently if they do, because we need to identify them so the appropriate code will be up on their records. Yeah.
No, thank you. Thank you. This next person has GH and they're taking a Pixaban and they're just wondering if they're able to donate while they're taking that drug.
So a Pixaban even know, and then it's understand why they're under, because sometimes it's as well, it's not only the medication, but it's the underlying reason for a Pixaban. So that is just putting a little bit of alarm. We need to do a bit of more assessment to see. So a Pixaban would actually exclude them from donation, and also with that, the underlying reason for a Pixaban. So in that case, we would not be able to accept that individual to donate.
Thank you for that. Thank you for explaining that. This next person says, "Hi Norda, thanks for an excellent presentation. I've
Thank you.
I've been donating blood during the last 3 years, but never registered as a hemochromatosis donor. I usually donate every 12 weeks as per advice of my specialist. My ferritin levels are at the lower end of the healthy range. For me to add my hemochromatosis status, do I just call the helpline?"
Absolutely. Just call and get on board. And you can continue. The individual will be able to continue on 12 weekly, but it's just nice that we can recognize. So sometimes it may change. You may find that there's a change. And then if we're not having you as the hemochromatosis code, you may get a delay. And also one of the benefits of the code, there are times when at the session when there's changes like logistical change or whatever. And sometimes as well, there are operational reasons why they have to cancel an appointment. However, we try or endeavor best that a hemochromatosis appointment doesn't get canceled. So that is only identified through having the appropriate code. So it's they will try at all costs not to cancel a hemochromatosis donor. So it's quite beneficial to have the appropriate code, though you can still continue donating 12 weekly as per the advice of your specialist.
So would they call the helpline to let
Oh
them
yes,
know?
absolutely, yes. Call the helpline to um get on to the appropriate coding. Yeah.
Brilliant. Thank you. Thank you. Hi Norda, did you say we will need to have ferritin levels monitored by a GP? If so, I struggle to get my GP to do this regularly as they challenged why I need it checked again. So it's easier at the moment to donate at hospital as they do the test as part of venesection booking.
It's whatever. I know some hemochromatosis donors are being monitored by a GP, and others are by their specialists at the hospital. So it's just great to know, and they will be on their condition will be monitored either by the GP or the specialist, because at some point, say for example, the GP or the specialist might initially have advised a 6 weekly appointment, a 6 weekly interval for donation. The ferritin levels may have come down so low that it says, oh, actually, no need to be donating so frequently now. 12 weeks to be fine for yourself. So who's ever managing your condition, just to ensure that your ferritin levels is just being routinely checked. So it's being keeping, because otherwise as well, we don't want to go to the other side where we're depleting you of all of your iron stores through this frequency of donation when you really do not need to be donating that frequently. Hence why we are encouraged to ensure either your GP or your specialist that's monitoring to keep a check on your ferritin levels.
Thank you.
Yeah.
We're over halfway through, by the way, now. There were quite a few questions today. It's great
But
to
that's
see.
okay.
My ferritin levels remained low for over 2 years, so I did not make any donations. When I rang to make an appointment when I was 72, I was told I was no longer eligible. I've finally been able to have a venesection in my local hospital on Monday with no adverse reactions. Does this change in your criteria and mean that I can register once again?
So for the donor, once they've had a venous section in the last 2 years, that will be classified as a blood donation. We could classify as a blood donation, and we can make allowance for them to join and get registered.
Brilliant. So hopefully that would help them to get back as a donor now that
yes,
now
that
that
they've
they've
had a
donated
venesection
again.
done.
Yeah, fantastic. Are people with homozygous H63D considered to have hemochromatosis by the blood service?
Yes, once it's established by your specialist and or GP that there is that you have genetic hemochromatosis homozygous, we do accept you as as hemochromatosis donor. So we do not make that diagnosis. It's a diagnosis that's after the various tests that the specialist will undertake and your GP. And once you come to us as with an established diagnosis of such, then you fall in the category of a hemochromatosis donor.
Thank you for that. This next person is asking how much blood is taken at a donation.
So at a donation, we take equivalent of 470 mils of blood. I'm not quite sure if it's the same. I think it's similar that is taken at the hospital. So it's 470 mils of blood. But also to be rest assured that that is taken in consideration to, you know, your height and weight, and that we're not exceeding the estimated blood volume for any individual. Yeah.
Thank you. This next person says, I had a DVT 4 years ago and I've been taking 4 milligrams of warfarin daily since then. Latest ferritin was 104. Have been blood donor in the past with over 75 donations and I'm 70 years old. Am I eligible to restart donating?
So we do accept individuals who's had a past history of thrombosis to donate. However, we would need to establish the underlying reason for that thrombosis. So often you would expect that they'll do making sure that a thrombophilic trait is ruled out. And once they have completed their anticoagulant treatment, and there's not a reason, the underlying cause is not a reason that would stop them from donating, that individual is able to resume. So, but I think it's mentioned that they're still on warfarin, taking warfarin currently. So, unfortunately, that would preclude you because we do not accept anyone on any anticoagulant to donate.
Thank you for going through that. If oh no, we've already answered that question. Skip to the next one. What are the HG level range to allow donation? What is the HG level range to allow donation?
HB. So for females, we accept 125 grams per liter and above, and for males, 135 gram per liter and above to donate blood. So that's 135 for males, 125 for females.
Thank you. This next person says, thank you for the webinar. It's been really helpful. I've not seen a specialist. I've been venisecting for 14 months and have reached maintenance. Do I need to contact the specialist to get a heart and liver test before I start donating?
Yes, we do, because that's one of the criteria. We just want to rule out that there's no involvement of the heart to liver. So if you can get that done, that would be great. And once you have had that assurance that your heart and liver, they're okay, then absolutely contact us.
Thank you. And I didn't realize at the time that was actually our last question, because the next question actually says, just to thank you for the session. It's been very helpful.
My pleasure. And this is our aim really, because we want to have as many of our donors, or we want to get the word out there. And I know there's still some hospitals, some hemochromatosis donor who is not even aware that they can come and donate. But I was speaking to one colleague from work, and we just happened to be talking, and she says, I've got hemochromatosis. She just recently started working with us, and through working with us, she's now aware that she can donate. So she has been donating. But like she says, at the hospital, there's so many patients that goes there, they're not aware. So as much as we can spread the word and say, come along, because it's a win-win for you guys as much as it for us. So we do encourage as many, hemochromatosis donors to join. And we are pretty much keen to build that relationship with us, Hemochromatosis UK, just to get the word out and just to make it clear in terms of the criteria, and just to ensure that the experience from yourself is as rewarding as it is for us. So my pleasure, and ever so sorry for the glitch at the start. My apologies.
It's okay, no worries. We got there in the end.
Okay.
And it was a really great presentation. Thank you
Yes.
very much.
Okay.
I really appreciate it.
Okay.
Just quickly, if I know people are probably wanting to log off. It's been
Yeah.
because I know quite a few of you are probably here on your lunch breaks and things. You've got things to get back to. I do have a quick poll that I'm going to launch just quickly. If you have time, stick around to do that. It would be really interesting to see the results of. The first question is just, are you currently a blood donor? And the second is, are you a donor with GH who has told NHSBT that you have GH? We were just curious to see the numbers on that. So that should be on your screen now for those of you that are watching. I know there are a couple of you on the phone as well. Well, from the numbers we've got, I think 33% of people on this call are blood donors. So that's great.
Okay.
That's really great.
Yeah.
67% aren't at the minute. And it
Okay.
says, are you a donor with GH who has told NHSBT that you have GH? 24% have said yes, and 57% have said no.
Oh,
19% have said they're not currently a donor / they don't
right.
have GH.
Okay.
Um,
So it'd be interesting to see the 24% as to why we weren't able to accept, or we'd encourage them to, try again, and we can go through the assessment criteria. Things might have changed. I mean, a lot of our guidelines, we keep reviewing our guidelines ever so frequently. And it may be that we have relaxed the guideline, which might have not been the case when you have contacted us. So, yes, do bring the helpline number. We'll be more than happy to assess you again.